Today we'll begin CNS, Central Nervous System. Today we'll begin with this. Come back. We have finished the respiratory system, gastrointestinal system. Today we'll begin with CNS, and we'll try to complete CNS, the big subject, big system. We'll try to complete the main topics in few days, and then go to the next system, and then finally we'll go to the practical exam oriented clinical examination and viva, instrument, everything else. I'll show you some instruments, X-rays, everything, just for you to prepare for the examination. Okay, when you, as a student, we all think that neurology is a difficult subject and very complicated one, and then we have a misconception and misperception about neurology, thinking that neurology is very difficult, very complex, and it needs a lot of investigations, and ultimately there is no proper treatment, and many patients will continue to be patients. This was the old concept that the fear complex that is felt by many undergraduates and postgraduates. Even we were thinking that neurology is a very difficult subject and all, but it is in fact. But the beauty of neurology is, if you really know a little bit of gross anatomy of the neurology and functions and of the different structures of the CNS, you will find it very easy actually. The only thing you have to study, you have to work hard for few initial days. Neurology, I say, is like mathematics. It's like mathematics. Formula is fixed. If there is a lesion there, the patient will have this symptom. If you know this gross anatomy and physiology, most of the times it will be easy for you to at least come to near correct diagnosis in the neurological diseases. So that is the misconception that we all have, that we think that it is difficult to diagnose. There's a lot of investigation. Ultimately, there's no cure. No, it's not like that. But it requires a careful, very careful history. Most of the time, neurological examination, the history will tell you the diagnosis. So if the properly taken history, properly given, properly taken history, the patient themselves will tell us the diagnosis. That's what the neurology is all about. So and the neurological examination should be a targeted one. Unlike other systems, like suppose in other systems, for example, there is a pulmonary edema. When you are talking about cardiovascular system examination, you encountered with pulmonary edema, which is a sign of heart failure. But then the pulmonary edema can be because of something else. So the neurology, beauty of neurology is you have specific signs and symptoms related to specific target disease. So the targeted examination will definitely help you to come to some neurological diagnosis proper. And now we have very specific investigations available, much before, unlike yesteryear. When we were students, in Usmania Hospital, where I was a student of Usmania Medical College, Hyderabad, is more than 150-year-old medical college, prestigious medical college of our country. There, our days, the neurology, there was no neurology unit. There was a department neurology, but the stroke patient, government hospital, Usmania used to be flooded with that was a tertiary referral center of those days, before these corporate private hospitals have mushroomed actually. So the stroke patient, I remember, used to be put on. Today somebody came and said, okay, let them lie down on the floor. We used to have floor beds. I don't know what is the status now, but we used to have floor beds. So many patients, there are about 100 beds in each ward. There are about 150 patients. So one entire corridor used to have floor beds. We used to sit down on the floor to examine the tooth, to take the history of the patient. So that was the status of stroke patients. We used to think that once it is a stroke, finish. It is a stroke. There's nothing much to do. Just keep them for 3-4 days and discharge. So there will be permanently disabled patients. So things have changed now. There's a lot of evolution has taken place in the neurological examination, treatment. So now stroke is not only treatable but also curable. For example, today we had a patient, right today, we had a patient, somebody called me around 2:30 when I was coming from hospital. They called me and said, somebody known to me, he just fell down and not able to move his right hand and right leg. And then I told him to rush to Care Hospital immediately, and within a few minutes, I also reached. By the time I reached, he was already in ER. So when I examined, he was only 45-year-old man, unmarried, 45-year-old man, hypertensive, non-diabetic, non-smoker. He has a right hemiplegia, almost grade 0 to 1 power in right upper limb and right lower limb. There was a facial deviation. Initially, when I was talking to him, he was unable to understand what I was talking. He was unable to understand what I was talking, but slowly when I encouraged him to, he was crying and he was understanding. When I told him to raise the left hand, he raised the left hand. When I told him to raise the left leg, he raised the left leg. So that thanks he showed, but he was unable to talk. I repeatedly asking him, he was a little bit upset emotionally. Then he started slowly telling the name slowly with he was a difficulty in speech, dysarthria. So this patient has hemiplegia, only 45-year-old male, hypertensive, dysarthria. When he took an MRI immediately, he came within 3 hours of the beginning of hemiplegia. He came from about 20-25 kilometers. So we took an MRI. There was a pontine infarct in the pons. We immediately thrombolized because he was still in that window period of 4.5 hours. We thrombolized with altiplase, which is a tissue plasminogen activator. We thrombolized him, and within 1 hour of thrombolysis, his upper limb, lower limb power improved to almost grade 4. So then I came back. The treatment was going on. So I saw him after 1.5 hours of thrombolysis. He much improved. So that is today's state. Stroke is become a subspecialty now. Stroke is a subspecialty, a super specialty in the neurology. We have a stroke unit. We have exclusive stroke specialist stroke unit. Stroke is nothing but paralysis. Please, my dear juniors, my dear undergraduates, stroke is paralysis. Don't use the word heart stroke. There is no stroke in the heart. Heart attack, you can say myocardial infarction, heart attack, but stroke, when we say, we always mean paralysis or cerebrovascular accident. So that is a status now. If the patient comes within that window period, we can bring back the paralysis normal. Otherwise, had he come little late, 1 or 2 hours late, we couldn't have thrombolized. We could have given only heparin, other conventional treatment, and he could have become a permanently hemiplegic patient, only 45-year-old male. So that is the importance of this modern technology that has come to our rescue of many patients we have treated, hundreds of patients we have treated. We have reverted this stroke, unlike the olden years. So 10% of all hospital consultations are related to neurological disease. That is a world study. Any hospital, you give any hospital, 10% of the patients will come with some kind of neurological complaint. And 20% of all acute in ICU and emergency admission are related to neurological diseases. 20%.